Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Colonoscopy recovery instructions and what comes next. Recovery from a colonoscopy, an examination of the large intestine used to screen for colon cancer, takes about a day. While the procedure lasts only around an hour, it takes at least 1 hour to recover from the sedative, and the rest of the day to rest and replenish fluids and nutrition. /r/n/r/n Generally, it is best to take the rest of the day off from work after a colonoscopy and give yourself 24 hours to feel 100% normal again. /r/n/r/n A colonoscopy is a minimally invasive procedure in which a flexible scope with a tiny camera, called a colonoscope, is inserted through the anus to examine your large intestine, also known as the colon or large bowel. While there are other colon cancer screening methods, it is considered the gold standard. /r/n/r/n Although it is regarded as minimally invasive, there are side effects associated with a colonoscopy that you need to recover from. /r/n/r/n Among these, you will need to recover from the sedative given intravenously, into the vein, before the procedure, most commonly versed, midazolam, or Diprivan, propofol. You might also experience minor rectal bleeding if any growths, called polyps, are found and removed. /r/n/r/n Other possible side effects include abdominal cramping, trouble passing gas or pooping, and feeling weak, lightheaded, or tired due to the lack of nutrition. /r/n/r/n It is important to remember that minimally invasive does not mean non-invasive. Between bowel preparation, sedation, and the procedure itself, your body has been taxed and needs time to recover. /r/n/r/n It can take around 2 to 3 days to have a normal bowel movement after a colonoscopy. The time can vary from person to person. When you do have your first bowel movement, you may notice a bit of blood. This is likely normal and not a cause for concern. /r/n/r/n After the colonoscopy is completed, you are wheeled to a recovery room or cubicle and monitored by a nurse until you awaken from the sedative. Once you are steady enough to sit up, you will be given something to eat and drink and asked if you are experiencing any side effects, such as nausea or dizziness. /r/n/r/n Once you are cleared to leave, you must follow your healthcare provider's instructions. This includes having someone drive you home. You will not be allowed to drive yourself or leave if no one is there to take you home. /r/n/r/n Once safely home, these are the general care guidelines. /r/n/r/n If your healthcare provider removed any polyps or took a biopsy during the procedure, it may take longer for you to recover. /r/n/r/n Some bleeding after you have had polyps removed is normal. For some, the bleeding may start a week or 2 after the colonoscopy. Talk to your healthcare provider if the bleeding is heavy, persistent, or simply worries you. /r/n/r/n Call your healthcare provider or go to the nearest emergency room if you experience any of the following after undergoing a colonoscopy. /r/n/r/n Around 1/3 of those undergoing colonoscopy will experience abdominal pain or bloating lasting from several hours to a few days. /r/n/r/n There may or may not be a significant follow-up after a colonoscopy. Moreover, the follow-up may be with the specialist who performed the procedure, called a gastroenterologist, or with the primary care provider who ordered the procedure. /r/n/r/n Depending on the specialist, you may be told immediately if any polyps were found or removed, or the information may only be shared in the pathology report. A polyp may not mean anything as most are benign, non-cancerous, and may only have been removed to ensure they don't become more extensive and turn cancerous. /r/n/r/n Generally speaking, you will be advised immediately if anything serious is found, such as a more significant growth with unusual features or bleeding. This is because timely action is needed if cancer is suspected. /r/n/r/n. Beyond that, it can take a few days to receive the pathology report results. The lab specialist, the pathologist, will review the images and perform tests on any tissue samples sent to the lab. The tests can reveal any precancerous or cancerous cells or if the cells are normal. /r/n/r/n. Some gastroenterologists will discuss the findings over the phone or mail you and your primary care provider a copy of the report. /r/n/r/n. Others will want to discuss the results in person at a follow-up appointment. This may be true even if no signs of cancer or precancer existed. If you are at risk of colon cancer for any reason, the provider will want to stress the need for routine screening and things you can do to reduce your risk. /r/n/r/n. Normal colonoscopy typically means that you can wait 10 years before having the next one. If you have 3 or more benign polyps, you may be advised to have your next colonoscopy in 1 to 3 years, depending on the size of the polyps. /r/n/r/n. A colonoscopy is a minimally invasive procedure used to screen for colon cancer. Colonoscopy recovery is usually quick, with most people resuming normal activity the next day. /r/n/r/n. Even so, it is important not to rush back to work. It is best to take the remainder of the day to rest, recover from sedation, and replenish fluids and nutrition. The results of your exam should be available within a few days. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.